Away from security to health matters, where the Nigerian Center for Disease Control, that's the NCDC, has reported 206 new cases of COVID-19, taking the country's total number of confirmed cases to 169,884. Lagos recorded the highest number of new cases with 132 infections, followed by Akwa Ibom with 56 new cases, while Ekiti had 5 new cases. So far, 164,733 people have been discharged, while 2,128 people have died from COVID-19 complications. And joining me live in the studio to talk more on the imminent third wave of COVID-19 is Dr. Tuyi Mebawandu. Good to have you join us.
Thank you for having me.
So everyone is saying that the third wave is imminent. We've heard that from even health experts. 6 states and the Federal Capital Territory have now been placed on red alert to show that things are quite critical in those states. But with the numbers that we are recording now, it is not up to 500. It's quite low. Do we say that we're at that point where we think that the third wave is imminent, especially when you also look at the fact that at some point we're not even recording cases at all?
Well, you have to look at the trajectory. We don't just look at the numbers and then make conclusions. Now, from June 11th up to now, we've had the new cases has actually doubled. Okay, barely 1,500, close to 3,000 now. The new cases of COVID-19. Secondly, we are seeing a gradual upping. And we know that we are sure that the Delta variant is already in Nigeria. Thirdly, the critical non-pharmaceutical interventions that we'll be preaching, people are not adhering to it. Parties are going on, churches opening, everything is going on as if there's nothing happening. And fourthly, we're not even having vaccines to deal with the severe cases of the severe manifestation of COVID-19 illnesses. And then, matter of factly, we are not on top of the information management. Our health system has not improved, in any way that you may. The doctors are running away, the nurses are not working, even in some states that doctors and health workers are on strike. When you combine all these things and you see your cases doubling, within a month, new cases doubling within a month, and then you see a sudden uptick in the numbers that are coming, you have to add this together and say that, listen, problem is coming. And if you don't actually really deal with the problems that is coming now, you want it to manifest fully, you want now to have a crisis in your hand before you now understand how this thing pans out. Because the reality is that we have to look at the tiny thing to add them together to understand that we're in problem. And sincerely, if you add all those few things I've mentioned here together, there's problem. And if you look at it, there are, if I want to talk about the information management, for instance, we have the conservative people that feels that, well, we price personal freedom against public good. Maybe the church people said, okay, they prefer their own personal freedom against public good. You have personal choice against public good, and they're now pushing their own narrative. But the demagogue, for instance, will manipulate expert opinion to push their own reality. In terms of information management, are we dealing with conservatism or demagoguery?
That's very key, because information management has been a big part of the COVID-19, managing the COVID-19 pandemic, where we see that there is an influx of fake news, and then you're trying to battle with all of the information barrage and trying to sift the one that is right and the one that is wrong. But you mentioned earlier with the vaccination, we even see that in a place like the United States, where they have vaccinated over 40% of their population, fully vaccinated. They are, as of today, over 80% of cases in the US is linked to the Delta variant.
And especially those places that there are no vaccination. TVC, listen.
And I was going to ask you what that means for us, if they're even having that kind of issue, and how many percent of our population has even vaccinated? Less than 1%. So what does that mean for us?
It means that, if we cannot then stand firm and push enough pharmaceutical interventions to reduce the new cases of these Delta variants, we're in for a big issue, a big problem. Because, like I said over and over, the game changer in this fight against COVID-19 is our ability to deploy vaccines. look for vaccines, bring it in, and deploy. That is in fact, that will kill all sort of conspiracy theories that is going on. You know, a lot of demagoguery is really going on. In fact, sometimes some of those religious leaders that are pushing this negative narrative about COVID, you wonder, is it conservatism they're pushing, or is it demagoguery? They're just manipulating expert opinion to push their own reality. You know,
Dr. Beba,
we must be able to, government must be able to stand on top of this and deal with those information management if we don't have vaccines.
Absolutely. Dr. Beba, right now, you said something earlier about our health system. I mean, it has been stretched. It has been stretched with the fact that at some point we're dealing with polio. Thank God for where we are now. But there are cases of cholera now being recorded in the country. We're just talking about monkeypox now in the country as well. And if you add that on top of COVID-19, it is not a good place to be. Are you satisfied with the level of enforcement coming from the federal government, if there is any at all, in terms of the use of these non-pharmaceutical measures?
What enforcement is happening? You know, you tell me what enforcement is happening. You're on the news every time. Tell me how many people has actually been taken and said, listen, we're sanctioning you for not wearing face masks. Even the leadership of the government, they were not putting on face masks in public functions. So have they sanctioned themselves? Then secondly, when you look at the control of the markets, the control of the churches, the control of the mosques, the control of parties, what has happened? Who has actually been sanctioned? Even those ones that are sanctioned, they are given kid gloves and then returned back to normal situation. So if you see those kind of things happening, in reality, there's no enforcement going on. Let us look for vaccine. That is the game changer. Let us look for vaccine.
Absolutely. And we hope that, they have said they're going for Sputnik 5 and one other vaccine, Moderna. We hope that hopefully that comes into the country and we can deal with some of these issues. Thank you so much for talking to us, Dr. Tuyi Mebawandu.
Thank you.